So, good evening again, everyone. Thank you very much for coming to tonight's Tackling Stigma Share and Learn session. What we're going to be doing tonight is we're going to be introducing you to some of our co-leads for the Tackling Stigma ambition, as well as introducing you to some of our wonderful volunteers who have been working on tackling stigma. We'll be kicking off tonight with a Q&A with the co-leads, and then we'll have a chance to hear a real spotlight of that volunteer work before moving on to an opportunity to go into some breakout rooms and have a really good discussion amongst ourselves. So a really good opportunity tonight to hopefully learn from one another and hear a little bit more about tackling stigma. We're hoping to finish no later than about 7:10. And if you do want to ask any questions, please do pop them in the chat. We'd very much encourage you to do that. So without further ado, I'm going to hand over to our wonderful volunteers, Vicky and Sandra, who are going to be asking our co-leads some questions. I think actually to start with, we're going to be kicking off with some introductions first. So I'll hand over to Andy to introduce himself, and then you can pass on to Vicky if that's okay.
Thank you. Yeah, good evening, everybody. As Charlotte says, really pleased that you've all been able to join us tonight for our Share and Learn session on tackling stigma. I'm Andy Broomhead. You might know me as Head of Communities and Volunteering at Diabetes UK, but I'm also our strategic co-lead on all our work for tackling diabetes stigma as well. And I've been in that role for some amount of years, over 2 years, let's say. And I'm really pleased that we've been able to kind of continue to understand more about stigma, be able to start, I think, to make some real inroads into how we start to change attitudes and understanding about what diabetes is. And it's great to be able to be here tonight to have those conversations with you. So I'll let Hannah introduce herself, and then I think we'll go over to Sandra, I think, for the first question.
Yep. Hi, everyone. Really nice to meet you all. I am Hannah. I'm the new campaigns lead focusing on tackling stigma. I'm quite new to the organisation, so yeah, I'm still getting to know everyone, and it's really fab to meet so many volunteers at once. But yeah, looking forward to chatting to you about stigma, hearing more of your experiences, and and telling you a bit about what we're doing.
Thank you. Sandra and then Vicky, I think.
Hi, I'm Sandra, one of the volunteers for Diabetes UK. Can I ask Andy or Hannah, what are Diabetes UK ambitions as a charity?
Yeah, I'm happy to take this one. And I guess there's kind of an existential question there, and then there's actually a slightly more practical one. So really quickly, our ambitions are really the areas of work we think we need to focus in to be able to have the biggest impact for people living with, affected by at risk of diabetes in any way, shape, or form. So probably some of you know that throughout 2024 we went through a big sort of change at Diabetes UK, and we've come out of that, I think, with a real responsibility to make sure we are focused on doing the things where we can have that biggest impact for people with diabetes. And tackling stigma is one of those areas. So in a slightly more kind of practical answer to that question, there are a number of different ambition areas that we have at the charity. I think the ones that are generally most applicable to our work across communities and volunteering are supporting the 250,000 people who are newly diagnosed with type 2 diabetes every year, supporting more people to get the access to better essential care that they need. We're looking at the prevention of type 2 diabetes and gestational diabetes, which is obviously incredibly important. We're doing a huge amount of work to look at how we tackle inequity and inequality in access to healthcare. And then, the kind of reason we're here tonight, which is tackling diabetes stigma as well. There's also something that I think is probably, close to many people's hearts around, fundraising. Kind of, I've done that myself. I'm sure many of you have as well. And I think what you will hopefully get a sense of by the end of the evening is if you want to do things like tackle stigma in a meaningful and long-lasting way, unfortunately, we need to be able to do that as well. So I think there's something about being able to tackle making sure we've got the income that we need to be able to do this as well. So hopefully that's all right there, Sandra.
Okay, the next question. Hannah, was you going to say something? No? Okay. Next question. Why is tackling stigma one of our ambitions?
Yeah, I will take this one. So just to touch on briefly, what do we mean by stigma? We mean negative attitudes and beliefs about an individual or a group because of their diabetes. And sometimes those attitudes can lead to discrimination against people with diabetes. Um, some of the impacts of stigma include poor mental health, internalizing feelings of shame and blame because of having diabetes, so taking people's attitudes on board. It can involve directing blame at other people with diabetes, so making comparisons to different types of diabetes and, feeling negative towards certain types of diabetes and not your own, or, vice versa. It can lead to frustration with friends and family and colleagues for their insensitive comments. It can mean having negative experiences at the doctors, so feeling like you're being told off for how you're managing your diabetes. It can even lead to discrimination at work, so not being allowed time off for critical health checks, or feeling othered at work because of needing to manage your diabetes at work. In general, it can involve a kind of increased mental load on people living with the condition, on top of the daily challenges they're facing, trying to monitor their blood sugars, monitor their food, etc., etc. But perhaps even more serious than that is that over the half of people we interviewed in our research said that stigma was causing them to miss healthcare appointments. So they were actually avoiding going to the doctors for that feeling of being told off, and that feeling of not feeling trusted by their healthcare professional. And obviously that is risking more serious health outcomes and complications. And crucially, we believe that stigma might be contributing to a low investment in diabetes care and research overall. So it's filtering right through to policymakers, government, healthcare research funders. So it's not just an issue affecting kind of interpersonal relationships, but actually might be holding people back who are having diabetes because of a deprioritization of the condition in society. So we really believe that tackling stigma is one of the most important ways we can make sure that diabetes gets the funding and the priority in research that it needs.
Yeah.
Vicky, I think we're over to you and your questions now, if you're happy to ask.
Okay, thank you. Good evening, everybody. So Andy, Hannah, what are Diabetes UK doing to tackle stigma?
Cool, yeah, I'll take this one again. So, I mean, we've been doing a lot so far. So we completed 3 pieces of market research with people living with diabetes from different demographics, with different types of diabetes, to understand how they're experiencing it. We launched our If You Knew campaign on World Diabetes Day last year, and I'm sure some of you were part of that fantastic campaign. We funded 2 multi-year research projects on stigma, which are underway at the moment. We've been building relationships with diabetes organisations around the world, so Canada, Australia, looking at how they're tackling diabetes stigma, sharing research with them, learning from them. We've got a specific panel of volunteers who have experience of stigma, and they're helping to shape our work with us. But we've got lots more work we want to do. So in 2025, probably there's kind of 3 things that we're trying to do. We want to raise awareness about why stigma is a problem for diabetes. So telling people about those impacts that I mentioned, the poor mental health, discrimination, the missed healthcare appointments, the underinvestment. We also need to educate and kind of reframe diabetes as a condition. So through something called narrative change. So that's telling different stories about diabetes. So changing the kind of public discourse about, how people understand diabetes, stopping them from shortcutting to misconceptions they might have about it, and actually making sure they understand that it's a complex condition, it's a serious condition, and that, the causes are complex, and it's really not what people think it is. There's a lot of misunderstanding out there. And then finally, we need to engage key audiences who are contributing to stigma. So that will be healthcare professionals, so doctors and nurses, friends and family of people living with the condition, colleagues, policymakers, really figuring out how we reach these people and support them to kind of realize the role that stigma is having. Nobody sets out to necessarily be stigmatizing, but they might not realize how they are contributing to a feeling people have that's causing them to miss healthcare appointments, causing them to sometimes hide their diabetes. So we really need to engage those key audiences. And crucially, later on in the year, we're going to launch our manifesto for change. So this will be our kind of official launch of our stigma campaign, setting out what needs to change, involving people living with the condition, calling on different audiences to do their bit to kind of support people and take action to actually reduce stigma. And we really want to involve lots of people living with the condition. So if you do want to be involved, we definitely want to hear from you, whether that's kind of helping us create video content or sharing your story or, inputting to our campaign materials, speak to your local volunteer leader, because we really want to shape this with you. So I'll leave it there for now.
Thank you. And then finally, what can supporters do to help tackle diabetes stigma?
Probably no surprise that I'm going to take this one. So I think there's a few things. I would say, firstly, kind of being aware that stigma is an issue in the first place. Probably doesn't feel like we need to say that, but I think from the experiences that we hear from people, I really think we do. We kind of need to be able to, call it out, name it, and understand kind of what it is. We have spent a lot of time talking to people who say, "Oh, I never feel stigmatized about, living with my diabetes," and then kind of go off and, rattle off 3 or 4 things that are absolutely horrific that I think, objectively you would say are grounded in stigma. And I think there's something that is so commonplace about a lot of it that it, becomes part of our daily lives in a way that, is unhelpful and is terrible. So I would say kind of be conscious about it. Recognize that people don't necessarily understand that they're experiencing it themselves, or they may not want to talk about how it impacts them. But, it's kind of part of this at the moment. It's kind of part of this ecosystem that we all have of living with diabetes, unfortunately. But that's something that we want to change. One of the other things, and I kind of feel a little bit torn about how to describe this, but I would say kind of speak up if you feel confident or if you feel able to. One of our former colleagues always used to talk about doing this with curiosity, was what he would say. Try and understand how or why people have a particular belief or a particular point of view, rather than, just kind of challenging and saying, no, you're wrong for these reasons. I think what we know about how we change people's attitudes and opinions is not just by telling them that they're wrong or they need to believe what we believe, but it's trying to understand what drives that. And that's not an easy thing to do, and I'm not kind of saying that you should go out and do that to everybody that you encounter. But there is something about seeking to understand why people have those beliefs and opinions and attitudes, and that helps us to change them in the first place. I would say linked to that would be to talk about your own experiences, again, if you feel comfortable or you feel able to. And I'm always a little reluctant to say that because I don't think the burden of responsibility to address stigma, should lay on the shoulders of people with diabetes. I think that's unreasonable. There's, as everybody said so far tonight, as I'm sure many of you, if not all of you, know already, it's hard, kind of physically, mentally, there's a lot going on there. And then I think having to feel like you're the one that has to constantly advocate and challenge is difficult. And I don't think, I certainly don't want Diabetes UK to be making people feel like it is their individual responsibility to do this. But as Hannah said, the way we change that is by sharing stories and talking about experiences. And if you feel confident or capable of doing that, if you feel like there's a relationship, with somebody you live with one of your healthcare professionals where you feel able to talk about the impact, I think that's a positive thing to do, but only do that if you feel comfortable or confident to do so. Emily's beat me to one of them. I was going to say that we've got a toolkit and we've got kind of an FAQ guide that I think Emily's linked in the chat already. And we're going to be updating that. Hannah and I have already talked about some of the things that we think we can add into those guides that you can find in Assemble. And I'm sure we'll be able to share the latest versions of them afterwards in some way, shape or form. But there's some kind of really, small but practical things that I think can start to help how we talk about stigma and how we feel more able to, I don't know, give it space in a room or a conversation, because I think that's really, really helpful. And the last one is really kind of to just follow on from what Hannah said at the end of her previous thing. So we are working on this manifesto for change. We're working on how we put in front of policymakers, healthcare professionals, kind of industry institutions, and the people that we have relationships with, what the challenges are around stigma. And what we want to do is make sure that that is informed by the experiences of people with diabetes. It's informed by the changes that you want to see in the world. And so hopefully, if I've got this right, there's a link that I've just popped in the chat, where you can tell us the one thing that you want to hear, the one thing that you would like to be different, and that comes through to Hannah and I, and it feeds into the wider conversations that we're having that will, hopefully help us to kind of continue to build the momentum around the change that we want. So I'll stop there because I'm probably over time.
Thank you very much to all our panel there, and thank you to our volunteers for asking those questions. That was brilliant. That was really interesting. Thank you so much for sharing that, and really interesting chat going on as well in the chat. So do have a little read if you've not looked there already. I find it really interesting how over half of people are avoiding their appointments because of stigma that they've experienced. And it's great to hear that there are some easy things that supporters can do to help with that. And I think going on to that Manifesto for Change link and just telling us what you want to see is a really great starting point for that. So please do visit that link if you've not already. So our next section, we're going to speak to our volunteers again. So Sandra and Vicky will be back on screen to tell us a little bit more about themselves and the work that they do. And we've also got a video to share from another volunteer who was unable to be here tonight. So I'm going to invite Vicky to share her spotlight first, if that's okay.
Thank you. Good evening, everybody. My name is Vicky Greenback, and I was diagnosed with type 1 diabetes 15 years ago. At the time that I was diagnosed, police officer, I still am now. And I think it was fair to say that there was a real lack of knowledge, understanding of what type 1 diabetes was, what it meant. I was worried that could I keep my job? Could I drive a police car with blue lights on? What would it mean for my family if I couldn't do that anymore? Financial, etc. So it's fair to say, and I know, most people on this call will experience a settling period when you experience that diagnosis. I think what made it probably more difficult as well, due to the profession I'm in, is that we deal with really things every day as police officers. So trying to get that understanding of, do you realise what this means, I found difficult. And I am one of those people, or I've certainly learned that I've had to be, as Andy says, one of those people that will speak out, that will stand up for themselves. But early days, that was very difficult. So what I decided to do sometime into following my diagnosis was to set up a support group within West Yorkshire Police for people who either live with diabetes, type 1, 2, care for people with diabetes, and probably, I would say, the most important part, those who feel that they need to learn a little bit more, whether that's as line managers, or colleagues who maybe work with somebody living with type 1 or type 2 diabetes, so that they're able to support them. Whether that's, and I've seen already within the conversation, whether that's around reasonable adjustments in terms of, levels of sickness, for example, because I speak within my own organisation, once you go above a certain level of sickness, then, disciplinary action plan type things kick in. But what a reasonable adjustment could be is that actually, because if the condition, and I know there's the Equality Act and everything, but if we just put that aside for 1 second, look at extending that period. Can we look at shift working? Do you need to work shifts? So the group really is sort of like advocacy and support for anybody living with, like as I say, living with the condition, supporting people home or or within the workplace. So far, we've had some really, really good guest speakers. So the groups, we've gone from, initially there were about 4 or 5 of us, a mixture of police officers, police staff with type 1 and type 2 diabetes. There's now over 50 members from across the region. So that's North Yorkshire, South Yorkshire, Humberside and West Yorkshire. We had, interestingly, have some paramedics in there too as well. And I'm very much led by the group as to what they would like, in terms of guest speakers and things. So we meet once a quarter. We usually have a guest speaker. We've had Professor Partha Carr, who's given a talk, Dr. Wakas Tahir, I think it's a GP with a specialist interest. We've had a nurse, forgive me, I can't remember her name, who came from Diabetes UK, who talks about things that, the treatment that you're entitled to. And by that, I mean, do you know that you have to get your feet checked? How often are you seeing a doctor? And I'm quite proud to say, I say proud, probably a little bit of a mix of emotions here, that the group will say they've learnt more in that half an hour or an hour with people like Wakas and Partha Carr that they've had from their own clinicians. So it's fabulous in that way. It's just sad that we can't get that time that we need with our own. I recently shared my experiences and the work of the group at the national conference, the Diabetes UK, which I can safely say, despite my role at work, the fact that I've had to speak to the press and things like that was probably one of the most nerve-wracking things I've ever done. But it always is when it's so close to you and so personal. But a really, really proud moment to try and communicate, what's happened to me. And like I say, it's just really interesting looking at the chat here, thinking, you're not on your own here. This has happened to us all. So I do feel really passionate about, stigma and tackling it and making sure that we're all on a level playing field. Just because we live with a condition, we shouldn't be denied. What I'm thinking about now is I know the people living with type 1 who see the same doctor that I do, but yet get offered different treatment options. And we shouldn't be in that. It's 2025. We should be past that now. So I'm really, really proud to be part of this. And thank you for listening.
Thank you, Vicky. That was really inspiring. What wonderful work you're doing, and incredible to hear about the support you're giving people in your workplace and everything you're doing to reduce discrimination. So thank you so much for sharing that with us. So next, I'd like to invite Sandra to tell us a little bit more about herself.
Hi, I'm Sandra, and I've been at Diabetes UK as a volunteer for nearly a year. I too have been diagnosed with diabetes, and that actually encouraged me to join Diabetes to help fight stigma. And one of the works that I've been doing, I wear many hats within Diabetes UK, so that includes going out and having an engagement with the community, where I was able to be a volunteer to carry out a presentation to actually share all the wonderful work that Diabetes UK does and give the opportunity for people to actually communicate back and ask questions around how they may be feeling. I've spoken to people in the community where they have missed appointments as well. And that's due for the fact that, of shame, they feel ashamed. Some people think it's to do with their food, they're not cooking the right food. Some people want to give up their main cultural food, things like that. So I've given them the confidence that actually diabetes is not just down to exercise or food. It has more implication and complications than that. So it includes genetics and also social inequality as well. So, for example, diabetes 2 is a umbrella terminology that is used for many factors of diabetes and also diabetes 1. So, one of the things that I do share as well is around people's beta cells. So, when they're not feeling too happy, I explain to them that for diabetes 2, some of the beta cells have gone, and for diabetes 1, there's, reduced amount as well. So people feel a lot better. So it's also just trying to use the right language around people who do have diabetes to help them overcome the stigma that is attached to diabetes as well. And all the wonderful work that Diabetes UK is doing. One of my top tips is that people should call the helpline and get support if they feel they can't go to the doctors or they feel there's no one to talk to. Then Diabetes UK is there to help and support them. And also, I'm also out into the community as well to help to engage and turn the narrative around as well.
Thank you, Sandra. Thank you very much for sharing. Really great example of tackling stigma directly out in the community and telling everyone about our wonderful resources here at Diabetes UK. So really great. Thank you so much for sharing. So next we're going to hear from another volunteer, Ken Tate. So if I could ask Emily to share Ken's video and we'll play that for everyone. Ken, nice to see you. Can you tell us a little bit about who you are and what your volunteer roles are for Diabetes UK?
Oh, it's a pleasure. What do I do? I'm a diabetes advocate. I'm a psychotherapist. I run my own family group for diabetes, all types. Since 2014, I think, is when I first started. I'm also a member of the Stigma panel, which has been running for, I think, about a year and a bit with Diabetes UK to try and help eradicate stigma with diabetes. So that's basically my role in that as a patient advocate for that, to help, as I said, to try and stop the stigma that is prevalent, unfortunately, in our society between diabetes people as well as also in the media, various other areas.
Brilliant. Thanks, Ken. So can you tell us a little bit about how you got involved with that Stigma panel?
I think I was asked, actually, more than anything else. I have been probably a very loud advocate against stigma probably on social media, probably more than anywhere else. And it is very much something that, as a psychotherapist, I understand the problems that can lead behind stigma, leading to people with diabetes not being able to manage their diabetes well because that area is mentally, emotionally, and everything else not great for you as a person with diabetes. And it is more prevalent to me is because of having type 2 diabetes is that it stops people from telling people about their own diabetes because of the shame and the guilt that we're made to feel because of the narrative of, it was your fault, basically. So that's probably why I was probably keen to actually be part of the panel.
Great, sounds like you're the perfect person to be on that panel, so thank you very much. And we're interested to know, do you have any experience of diabetes stigma yourself? Obviously, you've kind of touched on it a little bit there, and any experiences of where you might have had to tackle this or advocate for others?
Yeah, I think it's probably more social media. Me personally, probably with 26 years now, I kind of ignore people that are being silly by saying, "Can you eat that?" sort of thing. But it's the social media that I probably am much more involved in, because as I said, the guilt and the shame of people with type 2 diabetes, and even the stigma between type 1 and type 2, where we have what is called the othering, where people say that, oh, it's not my type of diabetes, it's the other type of diabetes. And that, to me, it needs to stop, because it's nobody's fault having diabetes. It doesn't matter what type of diabetes that you have. So that, to me, is where I probably advocate for other people. If I see something like that on social media, I tend to say something.
We need more people like you. Thank you, Ken. Okay, that's great. I think that'll be the end of your introduction. So thank you very much.
You're welcome. And sorry, I'm not going to be there in person.
Thank you. That's lovely to hear from Ken, even though he couldn't be with us tonight. And he gives some really good examples of how he's tackling stigma, how he has the confidence to stand up and advocate for people on social media. So that was really wonderful to hear, as well as his experiences of the stigma panel. So that's brilliant. That's brought us to the end. Thank you so much to all of our volunteers and our panel members for sharing there. So our next step will be to go into some breakout rooms for a bit of discussion with everyone.